Hello, and welcome to Own Your Retirement. My name is Albert Lalonde from Kaizen Financial Group. If you'd like more information about what you hear during our show today, give us a call at 586-752-7008 or visit us online at www.kaizenfinancialgroup.com. That's Kaizen, Kaizen. And while on my webcast, or I should say my website, click on the podcast page to check out past shows and to subscribe to our program on Apple Podcasts, Spotify, or Amazon Music. Okay, we all have a vision for our retirement. Maybe it's sleeping in, followed by late breakfast on the porch. Maybe it's more time on the lake cabin, or it could be spending your days painting Star Wars miniatures. Whatever your idea vision is for retirement, there's always a danger that reality won't live up to expectation. So it's common for retirees to have some regrets, whether big or small. Now, that's not to say they regret retiring or that their retirement is unhappy. Rather, the regret is born of the idea that, boy, if I just made this little strategy tweak, my retirement would be even better. So perhaps working just one more year would have completely changed your financial picture during retirement, or perhaps holding off on filing for Social Security would have made a big difference. Well, during our show today, we're going to address some of the common things retirees say they regret. But before we get into today's topic, let me introduce my co host, Tony Shore, whose only regret is that he's about to lose to me again, yet in another fantasy football season this year.
Come on. Well, speaking of fantasy sports leagues, you just shared that you're in a fantasy NASCAR league.
I am. I am. I just love the competition. I love NASCAR. Love following
Wow.
the races and the adrenaline, and picking to see who can win each race is pretty. It's actually pretty difficult, but
I would
it's
say it's
fun doing
very
it.
difficult. Yeah. I would say that's crazy.
Yeah.
I mean, I get fantasy football, but that's crazy, but I know you're really into it, and that's cool.
Mm-hmm.
So,
Mm-hmm.
um but yeah, that's interesting. I would have guessed that this topic is so important. And I never would have guessed you would try to bring up fantasy football. I think this is my year for fantasy
Okay.
football. This
All
is going to be
right.
my year.
I love it.
I want to avoid retirement regrets. My wife and I want to avoid that. So,
Sure.
what do you have for us today, Albert?
Well, let's refer to the U.S. News and World Report article titled The 10 Biggest Regrets of Retirees. Now, it offers up perspectives from current retirement that I think may be valuable for our listeners, whether you're nearing retirement or are already enjoying it. Now, the first regret many retirees confess is not saving more money before they chose to retire. Now, remember, once you're officially retired, paychecks, bonuses, and healthcare benefits, well, they vanish. And for many, once they begin feeling the reality of no longer having a paycheck, well, regret kicks in. Now, the article quotes a 66-year-old retiree from Michigan, that's interesting, who said that he'd wish he'd saved 10% of what he earned during his career and then invested that money wisely. So, and the article notes that he's far from alone in that sentiment. A 2023 consumer sentiment track from Lincoln Financial Group determined that more than 60% of retirees say they'd go back and do things differently when they think about how they plan for their retirement.
Interesting. And I would have guessed that some retirees have regrets about
Mm-hmm.
how they prepared or things they didn't do or put off, but 60%, that's a pretty stark number. That's a big number.
Oh, yeah. I mean, saying yes too often is, well, let's put it this way. That's the next retirement regret that people have done. And what I mean by that, many older Americans, they have a common reason some retirees don't have enough money saved is that they too often said yes to requests for money from family and friends and things like that.
Hmm.
In fact, the article shared a 2022 retiree reflection survey from the Employee Benefit Research Institute that asked retirees a broad question about what they'd change about their financial habits earlier in life, knowing what they know now. Well, while many respondents talked about saving and investing, many brought up the relationships. One said they'd wish they'd, quote, dumped my deadbeat boyfriend much earlier. And another explained they'd lend less money to friends who never paid it back.
Yeah.
And so during my career, I've had some uncomfortable conversations with clients who were so generous to their friends and family that they were putting their own financial strategy and retirement goals at risk. And I understand how difficult, even how gut wrenching, saying no can be. But sometimes you got to do what you got to do, Tony.
Yeah, and it's human nature, Albert, to want to help our kids out, right?
Hmm.
Or a
Hmm.
close friend. But like you say, saying yes to every request can lead to financial trouble. And just like the oxygen masks on the airplane, they always tell you put yours on first before
Yes,
you help your kids,
correct.
because you've got to make sure you're okay to help them later on. So yeah, you've got to help yourself first in financially. Otherwise, it's not going to do your kids any good because you're just going to be a burden on them eventually. So yeah, I think that's yeah, saying no is hard, but to
Yep.
borrow your phrase, Albert, sometimes you got to do what you got to do.
And once you say that first no, it actually gets easier. Just
Yeah,
so you
it
know.
does.
So you just
Yeah,
got to practice it.
yeah,
Now, inflation is difficult to project, as we know, while you're planning for retirement. So, some current retirees wish they'd crafted a financial strategy for retirement that anticipated higher prices on things like groceries, gas, and utilities, especially after the last few years. And
yeah.
don't forget that before COVID, the United States spent about a decade with nearly non existing inflation. But as I'm sure many of you guys know very well right now, during the pandemic, prices soared and many remained high. So for some, higher prices on the goods and services we all need makes retirement more difficult. So in the 2022 retiree reflection survey I mentioned just a moment ago, inflation was cited as a financial concern by 54% of retirees. And that number is nothing compared to what the 2024 US retirement survey from the global asset management firm Schroders uncovered. In that survey, nearly 90% of respondents reported that they're concerned that inflation will lessen the value of their assets. So the article theorizes that inflation concerns may be one of the reasons that data from industry group LIMRA shows annuity sales have significantly surged in the last handful of years.
Yeah. Yeah, that makes sense. And building a financial strategy that accounts for the possibility of higher prices during retirement and inflation is an excellent reason to work with someone like yourself, Albert. I know you plan in inflation rising
Mm-hmm.
costs
Mm-hmm.
into your retirement plans for your clients so they don't need to worry about it.
Yes, yes, for sure. You guys want to do a report like that. And also, you have to remember, many retirees also report that they waited too long to even begin planning.
Hmm.
The
Yep.
24th annual Transamerica Retirement Survey of Workers from June of this year found that baby boomers were a median age of 35 before they began saving money for retirement beyond their employer account. Now, clearly, that means those workers missed out on many years of compounding gains for the retirement savings. In addition to a delayed start on savings, some retirees also neglected important planning activities. The Schroeder survey found that 63% of retirees wish they'd been more diligent.
Yeah, and worked with a professional like yourself. That's the key
Yes.
to really having a successful retirement. Now, we should probably let our listeners know how to get a hold of you if they want to set up that no charge, no obligation consultation to get a plan in place. How can they do that?
Yeah, folks, listeners, you can visit my website at www.kaizenfinancialgroup.com. That's Kaizen, Kaizen, or call my office at 586-752-7008. Discuss how we can answer your questions and also address your concerns about retirement regrets, your retirement ambitions, or any other elements of your financial strategy.
All right. Well, you've been talking about some of the regrets that people may have in retirement. In our first segment, you talked about not saving enough money or not saving money at all,
Mhm.
saying yes too often, ignoring inflation. That's a big one. And then waiting too long to start planning. It's been a great conversation so far. What do you have for us next?
Well, let's go back to the U.S. News and World Report article titled The 10 Biggest Regrets of Retirees. It has some more interesting insights I'd like to discuss, the next of which is underestimating healthcare expenses.
Mm,
I can tell you from experience that healthcare costs often catch a lot of retirees completely by surprise. In fact, about half of retirees told Schroeder's 2024 U.S. retirement survey that they went into retirement under the belief that Medicare would cover many more of their healthcare expenses than it actually does. And then additionally, 36% of people who were surveyed by the Employee Benefit Research Institute noted that healthcare expenses are a financial concern that causes them ongoing anxiety. As an example, the article highlights a retiree from Virginia who confessed that the cost that comes with Medicare itself caught her off guard. Now, while her research told her that Medicare Part A is free, she didn't realize Medicare Part B has a monthly premium for both her and her husband. This year, that premium is about $175 per person, Tony.
wow. Well, I know you're well positioned, Albert, to help people design a strategy to
Yes.
incorporate healthcare costs and Medicare and healthcare needs into the overall retirement and financial plan, correct?
Correct, correct. We actually do a strategy with that just to make sure that they understand all their health care.
Yeah.
Now, other retirees regret not having secured, guess what? Long-term care insurance
Oh,
before they retired.
yeah.
When policies were more affordable. Now, more than 25% of people surveyed in the 2023 National Bureau of Economic Research working paper named not securing long-term care insurance as one of their biggest retirement regrets. Currently, the median cost of a private room in a nursing home is about $116,000 a year, Tony, according to the
Wow.
2023 New York Cost of Care Survey. That's huge. Now, if you spend just 3 years in an assisted living facility and 2 years, let's say, in a nursing home, you're looking at more than $350,000 of care costs. Now, Medicare doesn't cover expenses for ongoing custodial care, but long term care policies do. But if you wait too long to purchase a policy, you may be ineligible for coverage or the premiums may be extremely expensive. But
Mm,
be aware that you do have options beyond long term care coverage. You have like asset based long term care insurance. It's a life insurance policy that allows you to leverage your death benefit to pay for nursing care costs.
yeah. Well, and you've talked about this on previous shows. Long term care policies can be complicated, timing is important.
Yes.
Certain aspects of them can be expensive, but there are options available beyond standard long term care policies. That's good to know.
Definitely, and people should look into just your basics. There's so many different ways that we can look into long-term care. Now, the next regret that article addresses is keeping two homes. Yes, you don't need me to tell you that many people want to head off to warm and, let's say, sunny climates during retirement while maintaining bonds with family and friends in their own home community. Well, in that way, may mean keeping two homes. While that may seem like the simplest strategy, the associated costs can cause trouble for your retirement budget. The article highlights a woman who purchased a mobile home in Florida and then a mobile home in her native Michigan, thinking it would be, let's say, an affordable way to divide her time between those two communities. But it wasn't long before she decided to sell both mobile homes and build a sturdy Florida home designed to withstand, guess what? Hurricane weathers. Now, while she misses her friends back in Michigan, she's clear that she wouldn't have been able to afford her current Florida home if she kept her Michigan property.
Yeah. Yeah. And that's, having two homes can be tough. There are snowbirds who live in the north and then want to go to Florida during the winter.
Hmm.
But if you do buy a place in Florida, chances are your family and friends won't have any qualms about visiting from Michigan in the winter.
Definitely not. A lot of folks here are more than happy to go to
Yeah,
Florida.
yeah.
Well, the next common regret, Tony, is investing unwisely. It's one that I've heard often throughout the years. Now, respondents to the retiree reflection survey said they wish they'd used a Roth IRA rather than just a traditional traditional retirement accounts. They also wish they invested aggressively rather than speculatively when they were younger. And, withdrawals from traditional IRAs, we know, are subject to income tax because you make your initial contributions with pre tax dollars, while Roths provide tax free withdrawals because, well, you pay the taxes on your initial contribution with after tax dollars. Now, I want to be clear that Roths aren't the right fit for everyone, especially if there's a good chance you'll end up in a higher tax bracket during retirement. Interestingly, many respondents admitted that they didn't know that a percentage of their Social Security income, well, is subject to taxes.
Really? So obviously, that's an important thing to note for people. And you've talked about this before. If investing is part of your financial strategy, it's essential to only do that while working with somebody like yourself, because investing comes with risks and rewards, as well as plenty of rules and regulations. I
Yes.
wouldn't try to navigate that on my own. You want a professional in your corner, and I think that's just really, really critical to not make mistakes. And everybody's situation is different, and you know how to look
Yes.
at their situation and figure out how to help them meet their goals,
Yep.
correct?
It's about putting a financial plan together, Tony.
Yeah.
Pure and simple. Now, the next thing is filing for Social Security too soon. That was another regret that many retirees say they had. While the current full retirement age for most Americans fall between age 66 and 67, the Social Security Administration permits people to begin receiving benefits as soon as you turn 62. Now, doing so is going to cost you because your monthly payment could be slashed by as much as 30%. And
Wow.
that benefit reduction is permanent. In fact, a factor that came as a surprise to the 49% of respondents in the 2022 Social Security Consumer Survey from Nationwide Research Institute, who were under the mistaken belief that benefits automatically go up once they reach their full retirement age. Moreover, people who keep working while receiving early Social Security benefits may have them reduced even more if their income exceeds certain parameters, Tony.
Right. Yeah. And we've talked a lot about Social Security maximization in the past. You have a report that you can run for people. I
Hmm.
think that is a critical mistake that so many people make. A lot of people file as soon as they can at 62 because they think they're going to get more money that way, because that means more checks. But for a lot of people, that's just not the case. And they're taking a huge cut in payments. So you have to be careful. It depends on your situation once again.
Yeah.
And that's why I encourage people to reach out to you. Now, you've been talking about these common regrets retirees often have,
Hmm.
so we can try to avoid these. And some of the regrets you've covered: not saving enough money before retirement, not having a thorough strategy for inflation, healthcare, and filing too early for Social Security. What's next on the list?
Well, I recently came across an AARP article. Three new ways that Medicare is supporting family caregivers. I think that this article has some potentially very useful information, as I'm sure some of our listeners have experienced themselves. Family caregivers often find themselves in that role with little to no notice, which means they have to learn to become a caregiver on the fly. And I always think of it like bringing your, let's say, home your first child from the hospital. You have to take care of this baby, but wow, how do I take care of this baby?
Yeah, first time parents, I remember being there. Those first few weeks at home with a new baby are quite interesting,
I
but
can
it's
imagine.
also a reminder about something that we can overcome fears and our nervousness to get the job done.
Yeah, yeah. Well, let's say we can say that in April of 2023, last year, President Biden did sign, though, an executive order designed to offer support to the country's nearly 48 million caregivers. In fact, it included more than 50 directives to federal agencies to identify ways to better support caregivers who provide what the AARP itself estimated in 2021 to be more than $600 billion in unpaid labor caring for family and friends. In fact, the first way Medicare is offering support to caregivers is via payments to provide training to family caregivers. Now, under a rule that took effect at the beginning of this year, clinical psychologists, nurse practitioners, physical therapists, and other caregivers can bill Medicare for the time they spend training family caregivers. Now,
Mm.
people who are helping their aging relatives with important jobs like giving injections, managing medications, and let's say changing bandages, and now free or they are now free to ask medical providers questions about what they need to know and do. Now, the article quotes a caregiver who explains that nobody actually tells you how to change an adult diaper for let's say an elderly parent in a hospital bed in a way that's respectful and safe. Now, while most doctors and let's say other medical professionals were willing to offer answers and insights to those caring for a family member or a friend, they were often doing so on their personal time. Now, a caregiver can ask a doctor or a medical staff for help arranging for physical therapy or occupational therapy services to make, let's say, a home safer, or even training on moving someone in and out of bed in a safe way or wound care.
Hmm. And that seems like an excellent step. I mean, caregivers receive the training and answers that they need, and medical professionals are compensated for their time. That sounds like a win-win to me.
It is. And now Medicare is also providing extra education for patients with serious medical conditions. In fact, this rule permits Medicare to pay for what's called principal illness navigation services to help patients with high risk illnesses like, let's say, cancer, dementia, and HIV, AIDS, and their caregivers understand their condition and their healthcare needs and options. Now, caring for a loved one or close friend with a serious illness brings with it a mix of emotions. On the one hand, you're emotionally devastated for this person you care about, but on the other hand, you have to calmly provide them with care and support. These education services are intended for people whose healthcare needs are only going to get more severe. Typically, these people are at high risk for hospitalization, which means that their caregiver must also know how to navigate through the vast healthcare system, which is extremely complex. The article notes that these education services are particularly important for caregivers who will be going home with the patient who's been discharged from a hospital's intensive care unit.
Hmm. Well, I honestly think that's a great step, Albert. For a caregiver to know that they can ask questions and receive advice on how to care for somebody after a hospital stay is beneficial for both the caregiver and the patient.
Yes, yes, it is. Now, the final way Medicare is now supporting caregivers is through a pilot project specifically for those caring for a dementia patient.
Mm.
The program is called Guiding an Improved Dementia Experience, or acronym GUIDE, GUIDE. And it includes 24/7 access to a support line, care coordination, caregiver training, and at home or adult daycare services. Now, beyond the support line, the pilot program will also help patients and their caregivers better understand how to utilize the various medical services that are available to them, as well as ancillary services like meals and transportations. The program's goal is simply to improve the quality of life for those with dementia and for their unpaid caregivers in a way that may allow the patient to stay in their home longer. Now, while the pilot program isn't currently accepting new applicants, it could expand if the initial period is successful. Now, ultimately, the program could be a vital lifeline for many Americans because it's anticipated that by 2060, Tony, there could be nearly 14 million dementia cases, according to the National Institute of Health.
Yeah, it's crazy. It's almost epidemic proportions. Alzheimer's and dementia are out of control, and I'm glad they're trying to do something to
Mhm.
help at least with this. This has been an excellent show, Albert. We're out of time. why don't you let our listeners know how they can get a hold of you before we go today?
Yeah, listeners, you can visit my website, www.kaizenfinancialgroup.com. That's Kaizen. Or call my office at 586-752-7008. Discuss how we can answer your questions, address your concerns about retirement regrets, your retirement ambitions, or any elements of financial strategy. Remember, it's our goal to help you prepare for retirement you've worked so hard for so you can own your retirement, folks.
Well, great show today, Albert. And listeners, that does it for today's episode of Own Your Retirement with our host, Albert Lalonde.
Take care, everyone.